Thanks very much. And, I was just saying that at the end of last year, we had the chance to get out and see COVID testing in a lot of schools across the state. And it really gave us some great insights into what was working and what needed to be improved upon. So when we provide you with this information today, I hope you'll see a lot of the things that we brought over from last year that were real strengths of the program and some really great advancements and some changes, some enhancements that I think are going to make the program even stronger for this upcoming school year. So really want to get into it with you and tell you about what opportunities we have available for you. But first, let me just remind you who's with us and who does this work with us. Obviously, you've got myself and Lauren here from DESE. The Shaw Foundation remains such a strong partner for us and really appreciate everything that they do to support this initiative. And so Ross Wilson, Eliza Novak, Marisa Medellon, Meldonian, Marisa, Michael Madigan and Lizzie Gordon from the Shaw team are here as supports for you. I'll explain a little bit more about how to access them if you haven't already at the end of our webinar today, towards the end of our webinar today. And we also have such great colleagues from the COVID-19 Command Center, from the Executive Office of Health and Human Services, Jeremiah Hay, Sean Burpo, and Amar Parikh, who also have been just so great at just making sure we have everything ready for you today. So with that in mind, I just want to jump right in and tell you that, for today, we're going to be talking about the testing program. We're going to be talking about vaccine clinics just briefly, and then the next steps will really give me an opportunity to go back and recap really what we talk about for the testing program, because it will be a lot to take in. So the next steps will actually give me a chance to go back over and show you very discreetly what you need to do to get involved, to stay involved with our testing program for this upcoming school year. So as we think about the new testing program for this school year, I just want to always put it in the context of the bigger picture of all the mitigation strategies that we have in place for this school year. We explained at the end of last school year that we would not be, there would be no physical distancing requirements in place for this new school year, and we really stand behind that. We want students to get back to what looks more like that in-person learning that we know is so strong for them. So we are not requiring or recommending any type of physical distancing. The guidance that we came out recently with on masks. And so we just think about these layering strategies. We're trying to picture, having all of our students back in the school, many of whom, especially our younger students, are going to have masks. We know that we have made available this testing program as a key mitigation strategy. We also have our air purifier program back. And so just want to put in a quick plug for that. We included information about this most recently in writing in an FAQ, but just a reminder that you are able to access the Medify MA40 HEPA air purifier under the state contract, just in case you need to write this down, which is HLS06. The cost of each air purifier is $258.82. And if you have any questions about that, please contact Anne-Marie Stronach on our team here at DESE. And Lauren's just going to put her phone number in the chat in case you need to reach her. But I just want us all to be thinking about how all of these mitigation strategies, what the state's making available to you in the way of guidance, as well as in the way of supports like the air purifiers and this testing program, can all come together to really keep our students and teachers safe as we start this new school year. So let's get into the substance of the testing program and learn more about what's being offered for this school year. So last year we had multiple vendors who we worked with in providing our testing program. This year we just completed a competitive bidding process, a contracting process, and we've awarded our contract to CIC Health to coordinate all COVID-19 testing services for the upcoming school year. And we just really appreciate CIC's just incredible experience supporting and managing the logistics of our testing in over 500 schools throughout all of really last winter and spring. We put spring on this slide, but it started last winter, started in February, and they've been a great partner to us. And what I think is really important to know, and I can't wait to share more about this with you, is how comprehensive CIC's offerings are for you for this year. So last year we often called this pooled testing. This year we're going to be talking a lot more about testing services. And CIC is our partner to provide testing services, a wide array of testing services. And so, just thinking about what we'll have available through CIC include those comprehensive testing services, the on-site support to coordinate and conduct those testing processes, and then the additional logistical support, the training, the courier services, customer support. You see it here on the slide. I think we just really will have a lot of strength, a lot of varieties of support to pull this off, because like I just said earlier, when we had the chance to go into school buildings last year and talk with nurses and superintendents and principals about the efforts it was taking to pull off our testing program, really gave us, a really strong emphasis on these additional supports for this upcoming school year. And we're excited for CIC to be able to offer those to you. So a little bit more about what will be available to you. And starting with the pooled testing that we have has been really the bedrock of our testing system. I want to just say a little bit more about that for as we start this new school year, and some, I think, very important change in terminology. One of the questions that we got last year from a lot of you was about increasing consent rates. How can we get more parents to be interested into kind of consent for their children to participate in pooled testing? And we saw varying rates across the state. And so we took the opportunity this summer to step back and think about what can we do to get more parents involved in pooled testing, and really feeling supportive of it, that it's really adding value to the education of their children, the safety of their children in school. And so we worked with a research organization to conduct focus groups with representative groups of parents and guardians to really think about what are those barriers to participation. And what was so striking to us was that parents just across the board expressed a lot of concern about this term, pooled testing. It just did not engender trust among them. It felt to them like it was sort of a random, like pooling sounds like a kind of a random concept that could lead to inaccurate or inefficient results. And the parents themselves, through these focus groups, helped us craft a different name for the testing that's being done in schools. The way in which we can have this screening that can go on in schools. And they came up with, I feel like, a great term, this idea of a routine COVID safety check. And I think that just describes a lot more of what it is. I'm a dad, I'm a parent, my son's going into 10th grade. I think if, my son's high school reaches out to me and says to me, we're doing routine COVID safety checks, it just tells me a lot more about what this is. Pooled testing, it's a good term, but it's not a great term. And it doesn't immediately say this is about safety. It doesn't immediately say this is ongoing in that routine way, that it's just a check, and that, it's a COVID check. So we are encouraging you to take this idea that we heard from parents this summer and apply it to your communications with families. You're going to see this in the way in which we've set up our model communications for you with families, that we're not using the term pooled testing in any of our communications with families. You're going to see anything that we have that's outwardly directed, again, towards our key constituent group, which are families, to really protect the safety of students. We're going to be calling this the routine COVID safety check. For your purposes, if we're talking to you, we're going to be we'll still keep that word pooled, just so we, keep like terms and keep it, with a lot of new options for this year. We thought in our communications with you, we'll call it a routine pooled testing, routine COVID pooled testing. But as we look externally towards parents, we really want to make sure that we are really reaching them and really providing them with information that we think they will find more helpful. So before we go into more of what the testing services are, I just wanted to go back over, or just explain to you why you're going to see some change in terminology, the background behind it, and really encouraging you to take to heart this idea of how we can communicate with more parent-friendly terms, something that just I think will resonate with parents more than the terminology that we were using last year. So that sets up our terms as we go forward. Let's dive in more. So I talked about comprehensive testing options for this upcoming school year. there's a lot here, and we're going to need to come back to you with more information in the coming weeks. So, I hope that for today, you'll sort of take this as an intro, take this as kind of getting used to what's changed for this upcoming school year, and what we brought over that was strong and that we're keeping. And that really begins with that first orange box on the left there about symptomatic testing. So last year, as you know, the state provided an antigen test for symptomatic individuals if they were present in school and developed symptoms in school, right? We don't want students coming in with symptoms. If you're sick, it's another really key mitigation strategy that we're keeping in place, just like last year. If you're sick, you need to stay home. If you're symptomatic, you need to stay home. But if you do come into school and start presenting symptoms in school, remember, this goes for staff and students. So staff or students who exhibit symptoms in school will be able to access the BinaxNOW rapid antigen test. And I think that's really important for just getting those results. Remember, BinaxNOW gives us results within 15 minutes. And any individual who takes this, we will get that information. It'll just help us get that person, right, the care that they need to get home to start getting better. And it also helps us more immediately identify close contacts so that we can support them as well. We'll be telling you a little bit more about supporting students who have and staff who have isolated or mild symptoms in our forthcoming protocols document. So remember our protocols document from last year, we're updating that. It will be out very, very soon. But you'll also be able to use that. It's easy to keep this in mind. Symptomatic individuals, you can use anybody who's symptomatic needs to go home, right? If they have the kind of classic COVID symptoms. But students who have, or individuals who have those isolated and mild symptoms, we identified these last year. We said that, there are some individuals who are going to have those isolated symptoms. This could be the kid who has a headache, right? And it's an isolated COVID symptom. They could actually receive the BinaxNOW test and stay. They don't have to go home. We'll tell you more about that when our protocols document comes out. So I'm not going to go into that at length right now, but just know that BinaxNOW has a couple of different options with it, right? So the truly symptomatic individual, they're going to take it. They're going to go home regardless. The individual who has mild symptoms can take it and can stay in school. But again, I'll tell you more about that probably in a forthcoming webinar to explain the protocols more thoroughly. The second option, and I really want to stress option as you're listening to me explain these, what's in these three boxes, I want you to begin thinking about what's right for my school or district. Am I going to take advantage of all three of these, or maybe two or one? That's your option. That will be your decision to make. So I'm explaining them to you, and I want you to think about them as discrete and each available to you individually or all of them collectively. So I hope that as I'm explaining, you're beginning to think like, which ones do we want to engage in? Which ones do we want to invest in for this new school year? So test and stay is the next option here in the middle. This is a new idea this year. It's really based on medical science, though, that individuals who are identified as close contacts from within the school. So if you have a student who tests, let's just take a student to keep it easy. So student tests positive in a third grade classroom. The students who are around that individual who would be identified as close contacts can actually stay in school. They don't have to quarantine as long as they are receiving the BinaxNOW rapid antigen test daily for at least 5 days. And now keep in mind that idea of at least 5 days. So that could be 7 days of BinaxNOW testing, but at least 5. We'll give you more direction on this as part of our protocols document. But we would need to repeatedly test those individuals who are close contacts every day in order to be able to get the feedback on whether or not they themselves are testing positive and need to quarantine at that point. But we just don't want to have so many students having to quarantine and miss so much school during this upcoming school year. And again, we have some very good evidence that this test and stay model is as effective as quarantining in keeping individuals safe. And so we're really excited about bringing this to you. And the thing that I want you to be thinking about when you're listening to me explain this is that CIC is able to help you with both of these two options that I just explained, both the symptomatic testing and the test and stay option. When I talked about the on-site support that they can provide, that's available just like it was last year for the pooled testing. It's also available for symptomatic testing and test and stay. So you're imagining these close contacts needing to have BinaxNOW administered, and we're very conscientious of the workload that's in front of our school nurses. And so imagine though that you could have another individual or individuals in your building supplied by CIC who can help you with the administration of this BinaxNOW. Of course, we would love it, as much as you can use your own staffing to do this, that's great, but we don't want a staffing hurdle to be a reason why you're not able to offer these important services to students. So that's why we want to offer those additional supports, those additional staffing supports through CIC. So I hope that explains test and stay, at least the kind of some initial thoughts on it. And let's go on to routine COVID pool testing. Keeping in mind, this is the terminology I'm using with you, but we're hoping that you will call them routine COVID safety checks with your families, just like I explained before. So really important here, there's a big change here that I really want to make sure that you are hearing from me today. Those of you who did pool testing last year are very familiar with what's in our first bullet there. And this system worked really well. And I'm really pleased that you were able to take advantage of this last year. It's available again this year. So again, remembering that with pool testing, we have individuals, we collect samples, put them in tubes, groups of approximately 10 per tube, and send it off to the lab. If one of the samples with one of the tubes shows a positive result, you are notified at the school level, and then all individuals whose samples were included in that tube have to have an on-site BinaxNOW and or PCR testing as necessary as a follow-up. So if we get a positive result, we have to do a follow-up in the school of either BinaxNOW or PCR. So if that model worked for you, it is available again this year, and we're really glad to keep it alive for you. The other option, though, that's new this year is what's called in-lab in-lab testing. And so with this opportunity, we will be collecting 2 samples in the school, and one sample would be included in the pool and run through the pool. The other one will be held back, and if a pool shows a positive result, then all of the individual samples that were held back from that pool that match that pool, we then run those and get an immediate result, so that there doesn't have to be additional testing in the school. So you don't have to do that follow-up testing in the school. Essentially, it all happens at the lab. So we think that's a really great additional strategy for you. And you will have the option of either. So when you go to fill out your application, you're going to need to kind of know which one you're choosing. And if you're choosing the school-based follow-up or the lab-based follow-up, given those 2 options. I'm just going to pause there and see if any of my colleagues, Lauren, Jeremiah, if there's anything that I missed when describing these 3 options for this upcoming school year, anything that you want to emphasize to make sure that we go over more thoroughly as well. Jeremiah.
Yeah, just a very quick and perhaps small clarification. Thanks, Russell, and hi, everybody. For that second option there, the lab-based follow-up testing, there are 2 ways that can work. One of them is exactly what Russell just said about collecting 2 samples up front, so you don't have to collect them later if the pool is positive. And the other one is going to be, you can collect 1 sample. Right now, it looks like that's going to be saliva, and that'll be individually sampled and collected and sent to the lab, and they'll be essentially, they will group half of each of them at the lab and put those into a pool test, and they'll keep the other half of that first sample in case they need to test the individual samples after that. So that would be only 1 collection at the time, but they would be able to go back and test the individual samples afterwards. Just want to be very clear. Thank you, Russell.
No, that's awesome, Jeremiah. Thank you. And so keeping in mind the first option, Jeremiah, with the follow-up testing in the school, that is there a saliva option there, or is that all nasal?
Right now, that's all nasal.
Great. And so the second option, where the lab-based follow-up, we can do saliva or nasal collections. Great.
Having some mute fun. Yes, that's correct. It would change, and it would just change slightly what would happen at the point of collection. But yes, you could do either way.
Great. Thanks for that clarification. Lauren, anything else that I missed or that you'd want to emphasize further?
No, I think it's great, Russell. I would just say that there are a lot of questions in the chat about when the protocols will be coming out. So if you want to just give a voiceover about our expected timeline.
Yeah, so I would expect them out either later this week or very early next week. And I'll explain at the end of this webinar that we will schedule another webinar, most likely for next week, when we can go back over the protocols with you in greater detail, answer your questions. Really, our goal for today is to sort of orient you to the testing program that we have available for you. And then we think it'll be helpful to follow up more on the protocols as soon as we're able to schedule a follow-up and you've had a chance to maybe digest what we put out. Then we'll make sure that we are talking to you further about what's in those protocols. We're recording this webinar and posting it. We'll record that webinar and post it because I know that people have vacations at times in August as well. So that'll be great. All right. So just thinking about some, again, reinforcing what CIC will be able to do to support you, thinking about that, just like I mentioned before, those three components, the symptomatic testing, test and stay, and the routine COVID safety checks. All three of those components, CIC can help to coordinate, provide the support, the logistical services. I'll explain those a little bit more in just a second. And I just want to reemphasize this idea that you can select any combination of the components that I just explained. So we have this example on this slide that you might decide to start with symptomatic testing. You might say, I want to be ready. We're going to have a more obvious cold and flu season this year. So I want to be ready to do, frankly, diagnostic. We want to know what's going on with symptomatic individuals. We anticipate seeing more symptoms in school this year. So we're going to start with symptomatic testing, but you could add another option like routine COVID pool testing later. So just keep that in mind, that where you start is not necessarily we're going to end this year. I think it's important that we have all three testing options available for you, because we also just don't know the trajectory of the virus and what might come next. And so this is just making sure that we have options available and ready, and it's your choice as to where you would get started. So again, just going into a little bit further about the support that CIC can provide, and a reminder to you that this is being paid for through a grant that has come to our state from the Biden administration through the Recovery Act funds. And so these services, the testing services and these additional on-site supports are all at no cost to our districts, to our schools. And so the types of supports that we will provide through CIC include that district level program coordinator. Again, we were very struck when we went on site last year about how much that is such a necessary position. And so we talked to different districts. Some said, we really think that we need to provide this position. We appreciate that you might provide this through a vendor like CIC at the time, but we need to have control. We just know the context better. And so, you might find this helpful to have a district level program coordinator or someone to assist someone at the district level who you have. But again, an optional service that may or may not be useful to you. Then when we think about each individual site location, each school, you can have the support with specimen collectors and or observers. So those trained professionals who can help with either collecting samples as necessary or observing as students self-collect the sample in the school. And then we just, we watched firsthand. We got to see people kind of organize, all the tubes and the packaging material and get things ready for the courier service, and supporting the ordering process. We saw all that firsthand last spring, and so we wanted to make sure we continue to provide to you that on-site testing coordinator, that program coordinator, again through CIC, who can help with all of those services. you will access them through CIC. So once you get started with us, once you fill out our application process that I'll explain a little bit more about in a minute, you will get connected with CIC, and then CIC will work with you to manage those services. So there are some additional services though that that CIC will provide. And so a lot of this are just the basics, the fundamentals, like the physical materials that you need for testing. There's obviously the swabs and the vials, everything that you need, those physical materials. They'll help to manage the BinaxNOW ordering process. So in the past, just want to slow down here and have you think about this. Those of you who worked through my office in the past with Kristen Kastner on my team, with Lauren Wu, with Rebecca Sullivan, but particularly Kristen Kastner, you will now be working with CIC on this. CIC is going to help you with ordering your BinaxNOW materials. So if that's something that you are engaged, if you're using BinaxNOW, they will help with that test collection process and the software platform. Because remember, this is best managed all through a software platform that sends you those immediate results, can also help with parent communications, which I think is really important. And then a relationship manager for each school. So someone who can really support the onboarding and implementation process. And, there's just a ton of challenges that come up. And so that relationship manager from CIC can help you just address those challenges and do that troubleshooting and problem solving that you need to do. And then finally, they're also able to offer the shipping and courier service to get those specimens to the lab at no additional cost to you. Again, Lauren, Jeremiah, anything else that you want to add about the additional supports provided by CIC?
Just to clarify, I put it in the chat, but these supports are being offered to all schools that will be part of the program. So district, public schools, private, parochial, education collaboratives, approved special education schools. So if you apply to our program and you are accepted in, all of the supports that Russell just went through will be available to your school. And so just want to make sure to double down on that.
Great, thanks, Lauren. And then let's talk about the software portal. So if you used our system last year, if you were involved in our statewide model, all of our vendors had a software portal. CIC is now overseeing all of that for us. And I think it's important to note that the platform will vary based on what type of testing you select. So just our example down here, that if you've selected that in-lab option that I explained earlier, you will use a different portal than maybe what you were using in the spring, because it's a different system. And obviously the way in which you're sending in what you are sending and what you're getting back is a little bit different with the in-lab option. And so there are just some changes there. I think it'll be more apparent to you once we get into it and you begin to kind of interface with CIC and get training on the different platforms. It'll, I think, become a lot clearer to you, but just want to sort of tuck that away, that you will be using a software portal, but it might be a little bit different than what you had last spring in particular, even if you were working with CIC at that time. So we'll be glad to answer any questions that you have about any of what we're offering. That sort of covers all of the testing options, the additional support that CIC will provide, the software portal. But now I just want to move on to what steps do you need to take to get started. And so let's take a look at what needs to be in place in order to move ahead. So those of you who participated last year were familiar with, whenever you joined our model, whenever you joined our statewide program, there was this authorized school application that you filled out for us. The services we're offering this year are different. And so we need everyone to go back to the starting line and fill out this authorized school application. This is the way in to our testing program, our statewide testing program. So one point of entry is filling out the authorized school application. And again, those of you who did this last year will be familiar with these components, but there are a couple of little changes. So the statement of assurances, and I'm going to show you what the statement of assurances looks like at the end of today's presentation, is just your way of saying that you kind of affirm and attest that you'll follow the procedures that are involved with our statewide program and the responsibilities that come with implementing our statewide program. We need information about each of your schools that we'll collect through our school spreadsheet. You'll have to tell us which testing model you want to use and get started with. This can change during the school year, but we do want to know where you're starting from. And then if you're using BinaxNOW, there are some preconditions that we need to have in place. We still have that statewide CLIA waiver available to you, so it makes the CLIA process a lot easier. I'm so pleased that our partners at DPH have just done so much with us around BinaxNOW, and particularly this CLIA waiver, attesting to the training that will be necessary and the PPE that's necessary for when you're collecting BinaxNOW samples from within your school. So again, the main takeaway from this is, copy this survey link. I know Lauren's put it in the chat. We'll be sharing these slides with you afterwards, putting the slides in the chat. Lots of ways of accessing the survey, the application, but that's how you get started. And we look forward to, just getting you in the system, getting you connected to CIC. This is how it will happen. We can't get you started with CIC until you submit your authorized school application. So as part of that, once you get connected to CIC, then we'll be able to give you, CIC will give you through the platform, through the software platform, access to the online version of the consent form. But there's some really important things about consent that I just want to talk with you about today. And I'm going to show you the consent form at the end and call out a couple of key details about it, just so that we're all aware of what to be looking for in that consent form and really how to help explain this to our families. So we do have to ask for consent again at the start of this new school year. Again, as you saw before, the options are different for families, what we have available. And so we just really want to make sure that we get that consent here at the beginning of the school year from as many families as we can. And we think that there's such a great opportunity here at the beginning of the school year where you really have families' attention. You're sending home a lot of different back to school materials, back to school messages. They're coming from the district at times. Sometimes they're coming from the school. Sometimes they're coming from the teacher. But once you're connected to CIC and you can fill in all the information that's needed in our parent letter. It's not a lot, but you do have to customize our parent letter. You have to have the link to the consent form for your school or district. Once you have all of that, we would just really encourage you, while we have parents' attention here at the beginning of the school year, to use the avenue of your back to school communications to get this information in front of families. And so, back to school goes on for a while into the fall, right? Because you're going to have the messages that you're already sending now. You're going to have some more welcome messages right at the beginning of the school year. You're going to have your back to school night and all of the information you need to send out about back to school night. You're going to have, tables set up at open house night. I should just call it open house, not back to school. At your open house nights, they are so well attended by families. Just maybe lots of ways of getting this information in front of families so they can ask questions, right? Last year, I know a lot of you had meetings with families explaining what testing options are available last winter, right? So it was midstream last year. As you're thinking about your open house messages, as you're thinking about your welcome back messages, think about how you can include this as really a key mitigation strategy. It's really, we want parents to hear that we are keeping kids safe, because we are. Schools are safe places for learning. They are healthy places for learning. Our testing options just help us so much with that. And so just the more that you can talk to parents in, parent-friendly language, really stressing this is a core mitigation strategy, we think will be so useful and so important. And so, just wanting to make sure you have everything you need to get as many parents to be able to consent as possible. Keep in mind, and I'm going to go over this again at the end, the consent form is for all 3 modes of testing. And you might get some questions about that. What's on the consent form, it says the school or district will notify parents about which mode we are implementing, but the parent will off the bat give you consent for all 3. There's one consent form. We would ask you to avoid making changes to it. Hopefully they'll be consenting through the online portal as much as possible. But with this idea that your testing strategy might change during the school year, we think it's important to ask for consent for, again, symptomatic, test and stay, or routine COVID safety checks right at the beginning of the school year. And then it's on you as the school or district leader to make sure that you are notifying your families of which model you are implementing so that they're well informed of what their consent is leading to. So you're going to see that on the consent form. I'll show it to you again at the end, but I hope that's helpful for you to get your kind of your mind around what's coming with consent for this upcoming school year. As I mentioned earlier in the presentation, we are so pleased that we have the strength of the Shaw Family Foundation to work with us. We've been in constant communication with Shaw, the whole Shaw team during the summer, and they're really here to help you with any of the logistics, any of the support that you need. I know when we did our on-site visits in various locations throughout the state last spring, at the very end of the school year, we heard from so many school and district leaders who said, and they named the people at Shaw, and they said, we can't believe the support that we got. We couldn't have done it without them. That troubleshooting, that problem solving, it is readily available to you. And this is such a unique thing for our state to have such a strong partner as Shaw. I would just encourage you to start by looking on their website. They are updating their package of materials to be responsive to the changes that we've made in our testing program for this upcoming school year. So on their website, covidedtesting.com, you're going to find great updated resources that will help you get started. And then just a reminder that they're available through their website to get updated materials and information and effective practices. And if you email them, I know they get right back to you. I know that they will be in touch with you to help you problem solve and to think through how we can keep our schools just safe and healthy places for learning for all of our children. So would really encourage you, if you don't have to struggle alone. Our team is here for you, and the Shaw team is here for you to help you continue to move ahead. So just really excited about having their support, and look forward to any questions you might have about it. We'll save a little time for Q&A at the end. Let's go on to vaccine clinics, and just again, really key to the success of our upcoming school year is to help as many students and staff get vaccinated as possible. So we wanted to make sure that we're bringing to you today just an update and reminder on scheduling school vaccine clinics, that they're available. They're available now. And we'd love to see as many schools across the state host that on-site vaccine clinic as possible. And we think that beginning to, as you're doing orientation meetings and events this late summer, or at the very end of August or early September when classes begin, be a great time to host that on-site vaccine clinic. We've linked the form that you'll need to fill out in order to get started. And I think it's just important to note that, we have a lot of mobile vaccine clinics available in the state, but we'll need you to kind of be flexible with us when you select that date, because it just depends on what demand we have on any given date, how much availability we have. And so just be thinking about, you're asking for a date, we'll do it. I know the team, it's not me, the great team at our Executive Office of Health and Human Services will make sure that they are working hard to get you your most requested date, but it'll be available as best as we can make it for you. And then, just making sure that you're submitting that request, if you can, at least a week prior to the proposed date, just so that you have time to prepare, get that messaging out. We have time, the team who does this has time to mobilize and be ready for you. So we hope that, just filling out that form, getting started, thinking about when are those events that you'll have a lot of people present who might be interested in getting vaccinated would be a great thing to have happen. So just a few more details and logistics about school-based vaccine clinics. They are free of charge, and they're available to, the supports that would be brought in are free of charge, and they are offered to any individual, right, who wants to come and get them. And there will be a choice of either the Pfizer or J&J vaccines through these mobile clinics. Again, they're free to all. So it'd be great. It's not just students and staff, and certainly HHS team. I'll pause here at the end so you can correct me if I'm wrong on any of this, but all means all. We want anyone who would show up at a vaccine clinic to be able to get the vaccine. No ID, no insurance is required. But we want to make sure there's consent for anyone who is between 12 and 17 years of age. and that vaccine consent form can be brought directly to the appointment, and it's available online in several languages at the link that we have in this presentation. HHS team, let me just pause, see if there's anything that you want to add about the vaccine clinics.
That's excellent, Russell. Yeah, I just want to emphasize, as you led off with, that the testing that we've all tried to work together to make available to students and staff in schools is one of several mitigation measures that we're all working hard to push forward. And another one of those things is this vaccination push. If you have questions about this, please let us know. But yeah, thank you, Russell.
Thanks, Jeremiah. So let's just talk about next steps and review them quickly, and then I want to show you the forms directly. Lauren, did you want to jump in there?
I was just going to say that I am going to put the website where all of these materials that Russell is going to go over right now in the chat. So save the link.
Absolutely. So our new website, like last year, if you went to our pool testing website, we took that down to replace it with our new website about our comprehensive testing options available for you for this year. Lauren, it's all in one place this year, the website. It's not, you don't have to go to a BinaxNOW site and a pool testing site. We've got one testing site. That's correct, right?
Correct. Yep. It's in one testing website. This is not fully live on our website quite yet. It will be by the end of the day. So this link is only active to the people on this webinar right now, but it does have the application right there and all the documents that you will need. The translated versions of our documents will be posted by this afternoon.
Great. Thanks, Lauren. So just a reminder that to get started, to get connected to CIC begins with filling out the authorized school application and completing the statement of assurances. I'm going to show that to you in just a second. Reminder about the links for the vaccine clinics. Just a reminder that, once you get connected with CIC, then we'll be able to start, you'll be able to provide information to families. You can start talking to them about it now. There's nothing holding you back. Just like, I think it's hopefully helpful that I'm kind of giving you this initial orientation to what the testing options are for this upcoming school year. This would be a great thing. You can talk about it with school committee members. You can talk about it with parents, start deciding what direction you might want to go. But then ultimately, once you're connected to CIC, then we can make sure that you have the parent letter filled out with, the links that parents will need to get started a little bit further down the road. Again, once you're connected to CIC. And just that reminder to think about the terminology that we're using with families to, again, make it as parent friendly as possible based on the research we did this summer, and using that term routine COVID safety check externally as much as possible. We will follow up with another webinar, like I mentioned. So we know that we want to talk about the DESE DPH protocols for the upcoming school year. I'm anticipating that will be next week. We'll message it out like we did this webinar. And so I'm hopeful that, knock on wood, I'd like to think that we will be notifying you of that webinar by Friday so that you know what to expect for next week. And we also anticipate offering office hours so that once we have these webinars, we can follow up with just some dedicated time when you can reach out to us with questions that you might have, that you can sort of, have us available through office hours to be able to support your work. We'll also make sure that, as you are registering with us and we connect you to CIC, we'll make sure that you get information about the webinars that CIC will be providing. And so, Jeremiah, you don't have to complete the application process to come to one of these webinars. Is that correct? And can we just say a little
correct. Yeah, absolutely correct. And that's really helpful. Because one of the things that CIC is going to address in these two webinars is around basically like you have new options this year. You don't have to use them. You can do what you were doing in the spring if you're doing something in the spring. But we want to make sure that folks have a chance to get more information about the specific options that are available to them before they fill out the application, if that's what they want to do. That said, of course, as you said several times, Russell, you will be able to switch back and forth based on what you think is best for your school population and easiest for your staff. But certainly, we're fans of educated choice, and some of that education will continue on these webinars.
Great. Thanks, Jeremiah. So I'm going to wrap up The last slide again has the link to the website that Lauren mentioned, where our webpage is. And then just a reminder to use our email, where you can reach out to us with any questions that you might have. And Lauren's just putting that in the chat too, for you to have the email address. If you have questions that come up, we'll make sure that we get right back to you. But I'm gonna switch my share over to, right. Not yet, my friends. Hold on, give me a second. I want to just walk through the documents with you real quick, and we're ready to go. So what you're going to find when you come to our website, and you're going to give me one more second, and I'm there, and here we go. All right, so this is what you're going to find on our website. So first of all, our memo, our COVID testing memo tracks really closely to the webinar that you heard from us today. So if you're the type of learner that needs to read this, and Russell was talking fast like an auctioneer, I need to absorb this a little bit more. We've got sections that really match very closely to what we went over in this webinar today, and the types of supports that CIC offers, the testing options in more detail. So you don't have to rely on your memory or going back and rewatching the recording of this webinar. Really, everything we went over today is in the memo. The memo's on our webpage. Lauren, you've put the memo in the chat as well.
I did not put the memo in the chat. I put the website in the chat, and so people can download the memo right from the website.
Excellent, excellent. Thanks so much. I mentioned before that the way in is through our authorized school application. And again, those of you who did this last year, this should look pretty familiar. I hope not hauntingly familiar, hopefully just like a familiar friend, the application process. And once you go on to the next page, whoa, it won't look like that. But what it will bring you to is where you have to provide us with your statement of assurances. Will be one of the first things that you will need to upload to us. So we sort of deliberately did this because we didn't want you to get to the end and be like, there's a document I have to go fill out and get a wet signature on and upload it. We deliberately did this at the beginning to say, get the appropriate signatures on the statement of assurances and send it to us. So again, the statement of assurances just says, you're going to be responsible for following the requirements of the program. There are some places where you're going to just, fill in the name of your school or district. And we'll get that information from you. At the very end of it, again, we need the name of the school or district, the superintendent or executive director's name, phone number, date, signature, and then finally, just the list of schools for which you are submitting the statement of assurance. So, and you can continue if you have more than 15 schools, you can just continue the list. So again, just getting that kind of mental picture of what you'll be submitting to us through the survey, you get to the statement of assurances. It is available on our webpage so that you can look at it separately. You can download it separately on our webpage, but it's also embedded in the survey. So when you get to the survey, you can find it there as well. But either way, it's one of the first things that we need from you. The other thing that you're going to provide us through the application, through that survey, is our official application to be an authorized school. And this is where we ask for some, just detailed information that we need to be able to pass on to CIC. And a lot of it, shouldn't be unfamiliar, just, pretty easy information. But this is where we get down to a lot of the logistics, contact information, coordinators, phone numbers, just so that we know, so that, we get the right connection between the school and CIC directly. And, obviously some other information like the days of the week. I won't go through all of this that you would prefer for testing, but really glad that our team here put together a guide to the information that we need from you. So if you're looking at any of these questions and you think, what do they mean by that? Go back over to the spreadsheet guide and take a look. The final thing that I'll say here about this spreadsheet is that we included drop downs. So remember, we want you to be thinking about what mode of testing will the school participate in. Here we have the drop down, and you're able to select as many of these as is appropriate, although Lauren, help me out here. You can do all three modes, but if you do the, I guess, sorry, we get into the, where we have in-lab versus in-school follow-up testing is in the next question, right?
Yes.
All right, thanks so much for great. All right, so you might need to refer back to the guide to get any of the, the answers to how to respond to these questions. So I hope you'll find that helpful. We're getting there. I'll be with your questions in just a minute, but here you'll find also on our webpage the template for the letter for parents and guardians in your community. And just keep in mind that you're going to need to fill it in with, a little bit of information. That's why we put this up here at the top to remind you just to look for the highlights where you're going to need to put in information such as, are you doing nasal swabs or saliva? You're going to pick one and delete the other, right? Limit the confusion. We're going to need a link to your consent form, right? So that your parents are going to click on, by having this letter, parents can get to the consent form that will be on the software platform. Keep in mind though, that I'm going to the last thing I'm showing you is the actual consent form, which is available and will be available in translation on our website because we understand though that there are definitely families that won't have access to the online version. And so we can collect a paper-based version of the consent form. The last thing that I want to say before I turn to your questions is just that reminder that parents will be consenting for all three types of testing. That's what is described here. But we put in this important statement that your child's school will be determining which testing methods will be offered, and that you, school and district leaders, will provide parents with information about the services that you are providing, administering, and if there are any changes to it. And at the end, we included for parents an explanation of the possible test types. We try to be very brief about it so that, we just know that we've got to, really try to use this as much parent-friendly language as we can and be as concise as possible. So I just want to do that quick walk back through the documents that are available on our webpage. Keep in mind that it's really just that link that you need to get started. We encourage you to follow that. And Lauren, I'm glad to turn it over now to any questions.
Great. So there are some questions about who is included in this program. And so just wanted to reiterate that all K through 12 schools, public, private, parochial, are included and can apply through our application. Lots of questions about the protocols, which we will not get into the details, but we will hopefully be able to see you on a webinar early next week, which will send out communication widely that folks can know about. There are questions, Jeremiah, if you want to jump in about this, of what type of staff will be brought in by CIC? Are they going to be qualified? Are they health professionals? Can you give us any information about that?
Sure. Yeah, they'll certainly be qualified to do the work that they're doing. So in many cases, they'll be observing, or if you need it, administering samples for either the routine pooled testing or for the individual BinaxNOW tests based on age and all kinds of things. And they will have completed all requisite training to either administer or observe those tests. There is no certification necessary to perform those tests. If you perform them, I like to think it's a little bit more complicated than a pregnancy test, but not too much more complicated than that. And yeah, certainly they'll have met all necessary prerequisites.
Great. Lots of questions about the costs. Is it really free for districts? Will they have to assume any costs, anything that they need to be mindful of or to budget outside of this program?
Yeah, it's a good question. All of the costs that I mentioned that are covered. So anything that CIC will be providing will not be billed to districts. But there definitely is capital that districts have to invest in this. And we were, obviously we heard about this during the school year last year. We had our webinars where we had 3 great district leaders talk to us about how they got started with the program, the type of investment they had to make. And so, I think we know a lot about that from their firsthand experience. We saw that with our own eyes when we went on site. And I would actually recommend that if you're having questions about what type of local investment are we going to have to make of time, of talent? I think the Shaw team, and it's so great to have them here with us today, would be a great group to reach out to. They've been supporting a lot of the districts with this. I also think CIC can tell you, CIC's had a lot of experience with districts saying, here's where we know that you're going to need to, just make sure you have people who are on top of this and, organizing it and coordinating with the school nurse. And so I think that, it's not without some effort from the district. We've just tried to minimize it as best we can through the great supports that we know that CIC can provide.
Great. So there are some questions for districts and schools that participated in programming last year that were matched with a different vendor than CIC, and what that rollover or switch will look like, and if we have any information to provide them there.
Yeah, thanks, Lauren. We are still working on this. So the software piece is the one thing that's like really in flux right now. We and CIC are working very hard to try to ensure that if you want to keep doing the kind of testing that you were doing in the spring, that you'll be able to use the same software platform that you were using then. As we had said in the slide, if you want to change testing methods, then, for example, Ginkgo's software just wouldn't be able to support the in-lab deconvolution option that we talked about for the routine pool testing. So, there are certain limits, and if you want to change types of testing, you probably will have to change the software that you're using. But again, I wish I could make a blanket promise that we'll be able to support everybody. I think that we're going to get there. I'm 85% sure that we're going to get there, but we're working really hard and know that that's, we're very conscious that a lot of people took time to learn a system in the spring, and that they had a lot of other things to do while they were doing that. And they still have a lot of other things to do now. And we want to make sure that if they want to just keep doing what they were doing, that they can do that. That is something that CIC will be able to talk to you in more detail on their Friday and Tuesday webinars as well.
Great. Participants are asking if all students need to reconsent or if they can use the consent forms from last year.
So everyone does need to reconsent. The consent form is different. And again, I know that I think I just really ask that you explain this carefully to parents, that they are consenting for all 3 types of testing, but you will notify them very closely and make sure that they're well informed about what you're actually implementing. And again, with the idea that you might need to pivot during the school year, and you want to make sure that, what we're doing is we're asking parents to commit to participating in all of any type of testing that we're using to keep our schools safe. And so it is one consent form. It does have all 3 types on it. We ask you not to change that. You won't be able to change it in the software program anyway. And I think that will take some, very, thoughtful communication with your families to help them just understand why this is important to consent for all 3 types of testing. Great.
And then, oh, go ahead, Jeremiah.
Noel Freeman had asked me a great question in the chat, which is how will the CIC webinar links be shared? And when we communicate out to everybody on this call about the protocols document and when we're going to be able to talk about that, we will also include the links to those CIC webinars as well. Thanks, Noel.
Great. And then just one more question about who can get tested by this. And so can it include faculty and staff and other members of the school, or is it only for students?
Lauren, go ahead.
Yeah, sorry. Any member of your school, faculty, staff can participate. So it's not just for students. And we really encourage you to involve all of your members of your school staff in district and school-based to participate.
Great. I know we're right at time, and I know I'm even seeing some questions coming into me directly. So we're going to make sure that we follow up. And like I said, when we have a follow-up webinar next week, we'll be able to answer even more of these questions. We look at them very carefully and catalog them. I know that Sean's final word to us before we got started today was make sure you save the chat. And so we will be very diligent about doing that because we know that we need to continue to provide you with information. I am so appreciative of your time today. I am so very inspired by your dedication to our students, to our families. We hope that you have a great beginning to this new school year, and I look forward to seeing you soon. Take good care, everyone.